are the first to answer the call for help, but a growing number of first responders are actually walking away from the job, and sadly, far too many are taking their own lives.
Yeah, get this. According to the Department of Health, nearly 300 police officers commit suicide every year. More are suffering from addictions and mental health challenges.
There are only about a handful of rehab centers around the country where these officers can get the help that they need.
Yeah.
And Delia Gonsalves takes us to the 911 Center for First Responders right here in Maryland.
Our nation's first responders are in crisis. The U.S. Department of Health and Human Services reporting roughly 30% are suffering from addictions, depression, post-traumatic stress disorder, and suicidal thoughts.
They're emotionally, they're physically, mentally, and spiritually bankrupt when they walk in this door.
The door of the National Law Enforcement Wellness Center at Harbor of Grace, a 28-day inpatient rehab facility in Harford County, Maryland. It's one of 6 wellness centers in the whole country approved by the National Fraternal Order of Police.
We're America's 911 for officers in crisis.
A badge of honor for Ken Byer, an EMT who founded the facility in 2015.
I'm a recovering alcoholic of 30 years and had a lot of emotional and mental health pain in my life, and I've now opened a center to help people that suffer from the same thing that I suffered from.
The highly confidential, highly secured, and monitored facility is run by current and former first responders, a team of psychiatrists, nurses, therapists, even a rapid response team of hostage negotiators and interventionists.
Everybody who works here knows what it's like to hold a dead baby. And that's really important for the immediate connection between the provider and the patient.
The center welcomes first responders from 40 different states, from Hawaii to Harbor of Grace.
I was expecting to try to save my job, save my career, but it turned into something a whole lot better than that.
Harbor of Grace, Maryland Police Detective Jay Cooper has been clean since his arrest for disorderly conduct. He stayed for the 28-day treatment and continues therapy with peer support groups.
It was just years and years of not talking about things that bothered me. And then, at least for me, led to self-medication, being depressed.
Was very much in denial.
Robert Quick spent 26 years as a Baltimore City police officer. He arrived at Harbor of Grace when his job was on the line.
I never used alcohol on the job, but did indeed fail a breathalyzer test where I was still intoxicated from the night before.
Quick ultimately lost his position at the police department, but is now working at the center, trying to help others avoid his own pitfalls.
I think the stigma is going away, but I still think there's a lot of work to be done.
This is our roll call room. This is where we do group therapy.
Byer says officer wellness is becoming a priority in a growing number of police departments.
This was designed by a MPD officer.
Including D.C.
D.C. Police, Metro Police has 7 districts. A lot of officers call us the 8th district.
In the acute medical building, white noise welcomes patients who are monitored by nurses 24/7. The artwork on the walls, the grounds.
It's available to every patient here.
The gym, all designed by Byer for the first responders.
I got the help that I needed, and I'm moving forward.
Who need rescuing themselves.
I believe the place saved my life.
This is a place where they get their soul back. There needs to be more places like this. There's just simply not enough.
In Harbor of Grace, Maryland, Delia Gonsalves, WUSA 9.